13 hours.
Hello, everybody. Welcome in, whether you are on YouTube or Facebook, wherever you are coming in this morning. I'm coming to you from Southern California. My name is Dondi Dolan, and I'm so happy to see you. I am bringing to you today the beautiful and amazing Adriana Barraza, or Adriana Barraza from Mexico City. And we're going to be talking today all about menopause. If you are a woman, you want to be here. I'm not even going to say if you're in menopause. No, if you're premenopause, if you're postmenopause, if you're in menopause, if you've been told you're in perimenopause, if you are a woman, you want to be here and listen to the wisdom of this woman who has been with us in Eden for over 20 years. She is one of our very advanced faculty members, a practitioner of Eden Energy Medicine. She's a doctor of chiropractic, and Dr. Adriana has been a doctor in Mexico City for, I think, 30 years now, has a huge clientele of people who tell her she has saved their lives. And she is here to save your life, whatever you are experiencing. If it's the night sweats, if it's the rashes, if it's the foggy thinking, she's going to talk to you about more symptoms and feelings and weirdness you might be going through that you didn't even connect to menopause. She's unique. The work she does is unique. You will not find this anywhere else. So come on in, join us, open your ears and your heart, and we're going to be with you for the next 30, 40 minutes or so, however long Adriana can give us her time. Hello, we're so happy to have you, Adriana.
I am so happy to be here because this is seriously, this is life-saving knowledge. If you are here, you will get so much. And there's so many people now talking about menopause, and we'll get into that because it is not only talk about menopause. Donna has given us an amazing, amazing map for menopause. And when we put it together with functional medicine, it is a treasure. So I'm really happy to be talking about this, but not only talking about it, but giving you an overview of what really menopause is.
I'm so excited for this. And I'm so excited for you to tell us about the map and so many other bits of knowledge and expertise and wisdom you have, because you look at menopause a very different way. And I have my phone over here. I'm looking at Facebook. I'm looking at you. I'm looking at YouTube. I'd love to know who's with us, where you are from. If you'd like to put it in the comments. Adriana, again, is in Mexico City. I'm in San Diego. We just had an earthquake this morning. We are rocking and rolling, and we are here with you today. So let me take a moment and just ask you, Adriana, you have so much wisdom. You belong to an anti-aging academy that has been going over 20 years. You have experience, well, a master's in functional medicine. You have experience in a lot of different modalities, but you've really honed in on menopause. Why? How did that come about? What interested you? What sparked you?
Okay, so I'm going to start saying that hormones, they really are the fountain of youth. I mean, if you could just take that in, hormones are the fountain of youth. You have to remember that I've been in energy medicine for over 20, almost 25 years. And when I came in, I was in my early 30s, right? And I was with all these amazing women, and I was incredibly surprised. They were so vital, starting with your mom. They were so vital. They were so sexy. I mean, the stories we had after class, I was like, okay, you know what? I'm going to be like those women when I'm 50. So now that I started learning all their secrets, and Dundee, that we have been teaching in Eden Energy Medicine, the hormone class for years now. And before this knowledge was only for our practitioners, but now we're opening it up because we really feel there's a need for everybody to know about this. But very soon, I started seeing that these women were talking about hormones, and I became incredibly interested in hormones. And when I did my master's in functional medicine, really a big chunk was hormones. So I really got interested in them, and they are not as easy as it sounds because everyone is so different. But if we follow the map your mom laid out for us, Donna Eden laid out for us, and the map that has it goes perfect. I was impressed when I did my master's, how impressive it was that Donna was doing functional medicine before the term was coined, right? She could see the energies and she could see where they were going, and she laid out kind of like a map. So that's what we're giving you. It's not only talk, because it's great, and that's the first step of the map, to be aware. But hormones, if you know how to do hormones, and like Dondi said, I loved it. This is not only for menopausal women. I taught my kids, my daughters, how to do what we're going to teach you, and they know how to bring on their periods, how to help themselves, how to become vital when they're exhausted, what to do, everything. It's just every woman. I know we said menopause, but we could have said class for every woman, because the younger you are, the better. And if you're 80 years old, I don't care, your hormones. I have so many testimonials of women that are in their 60s that we start doing this and they come back to life. That's why I love it, because more than any other thing that we can do, hormones makes you come back to life. Your hormones that are, balanced, they make you come back to life like nothing I've ever seen.
Fantastic, Adriana. Well, I want to give some shout outs here and just let you know you have folks watching us right now from South Africa, from Iraq, Arizona, Corsica, Oregon. Hello, Katya, Leslie, Kelmy, Carrie, Albina. So great to have these folks with us. And I would just like to read something, Adriana, because I saw this. This is one of your patients who gave you an amazing testimonial. You have so many raving testimonials from women who you have helped through menopause and with menopause, because we dance with menopause. You always say it's not getting through it, we dance with it. And this is what this woman says. Her name is Jessica, and she says, the hormone exercises and all the route we followed from Dr. Barraza marked a true before and after in my life. Before, I was dealing with hot flashes all day, morning, afternoon, and night, mood swings, health issues, constant anger. I felt overly sensitive, emotionally drained. Everything changed when I started with Adriana doing the exercises, stimulating my hormones. So she goes on and on and on to say she comes to the nut of her sex life and how amazing it is now. And it's the surprising gift that you gave her, Adriana. She says she feels like she's 18 again. She's in pure paradise. All of the changes have transformed her life. And her husband says to you, thank you for everything.
I think it's the husbands that love me more than the women. But okay, so you just touched on a really important point. Menopause is not a flu, all right? It's not something we just go through like, oh yeah, well, I don't have my hot flashes anymore. Menopause starts when we're 35. Some start as early as 35, starts with perimenopause. And as we go through and we get closer to 50, that's when our hormones really we stop producing hormones. And what I want people to take with them is that when you stop producing hormones, you lose the protection of your hormones. And you really have to know how to bring them back to life and how to stay very, very balanced so that you can prevent most of the diseases that menopause brings, because people just think it's about hot flashes and insomnia and hair and weight gain. Those are the usual ones. And yes, they're horrible, but there's so many others that are not, they're silent. Your bones are silent and you're going into osteoporosis. Your brain is silent and it's already, you know, when we stop the hormones, it's already starting to deteriorate. So we have to stop that. Your heart is silent. No one ever says, oh, you know, in 2 days, you're going to get a heart attack. I wish, but there's nothing, there's no pain, there's nothing. So I want you to all know that, okay? Because this is really important. And Jessica was a very funny, I'm really impressed by the testimonials, to be honest with you, because I asked, if they could give them to me. And when I see them, they're always going, oh, this is wrong and that is wrong and this hurts and that hurts. So when I read the testimonials, I was like very touched. I was like, oh my God, really? But Jessica was very funny because she came to me saying that she was about to divorce her husband because she didn't want sex anymore and she just felt like she wanted to kill him. And, you know, that's part of it, the moodiness, right? The moodiness is really big on menopause. And the other is you really truly lose your libido. It's like, it's more fun watching Netflix than being with your partner. So I listened to her and I said, okay, all right, that's fine. Why don't you give yourself 3 to 6 months? And then you can decide whether you want to divorce your husband, right? So just give, you know, you're going to save a ton of money for the divorce lawyers and stuff. So just do it. And she did. But I want to say something here. All these testimonials are for women that are not looking for a magic pill. All right. We're not giving out a magic pill. If anyone is looking for a magic pill, this is not it, because this is a commitment to do the exercises. I tell them 4 to 5 times a week, right? They can rest 2 or 3 days a week, but do the exercises that take about 15 minutes. And they did. They committed. They did everything it took, and the results are amazing. I mean, just look at Jessica. She was in a horrible mood. She wanted to kill her kids. She had no patience. She wanted to kill the husband, everything. And she has really turned around. She sends me pictures in beaches and saying, having fun. You know what having fun means. And I'm like, okay, that's great. You know, so really it's this vitality that you come back to. And many women say, I came back to myself again. That's what struck me the most from all these women that we've helped. It was, I came back to being myself again. I had forgotten how that felt like. So that's really touching.
Very touching. And Adriana, I'm going to read something here. I read from the Mayo Clinic, this came out in 2022, that only 13%, 13% of women receive a correct diagnosis for menopause and the help they need. And so women are dealing with a lot of symptoms they don't know what to do with. You've taught me about symptoms that women don't even think of in the menopause world. And I was reading this morning, there are over 40 symptoms that women deal with. And a big one is burning mouth syndrome. Another one is a really weird word. I had never heard this word. It's not fornication, it's formication with an M. And it feels like insects are crawling in your mouth. So you have talked about this. Tell us a little bit about some of the things that women might be feeling, and they don't even attribute it to menopause. And then talk about the map. Let's get into the map after that.
So this is really interesting question because menopause, so first, menopause is incredibly individual, okay? So you may have a symptom that no one else has, and you are going from doctor to doctor trying to get this fixed. And the problem is not many doctors are really trained in menopause. So again, this is not, functional medicine is trained, so all the doctors that are functional, they will always scan your hormones if you come with a certain age, but still, it is impressive how many women have really weird symptoms. So I was born in my career as a doctor, as a chiropractor, and so many women will come to me with frozen shoulders or neck pains or back pains, and it has to do with hormones. Even Oprah has talked about how she went, Oprah, I mean, you know, it's a woman that has every single resource at her hand. And she was going from doctor to doctor, and no one would tell her it was menopause because the symptoms can be so isolated, right? Someone can have a deep depression and they're just on antidepressants or SSRIs. And it's like, okay, well, it might be menopause. Someone might be going through musculoskeletal syndrome, which I see a lot of. It can be menopause. Some others a lot of them come with urinary tract infections. I see them when they're on their 10th antibiotic and just realize that it's not going to help. Again, it's hormones, it's menopause, fatigue. Some women come to me saying, you know, I've had all my lab tests done. They can find nothing, but I have a horrible fatigue. Please help me. Itchy skin, heart palpitations. Heart palpitations are a big one. Acid reflux. When have you ever thought that acid reflux could be because of menopause, or bloating could be, you know, they come to me bloated, like I'm eating what I regularly eat and I can't, my stomach is just horrible. My gut. So so remember, that's very individual, and it's just like fibromyalgia. 20, almost 30 years ago, when I came out of school and would tell orthopedists, you know what, this woman has fibromyalgia, they would laugh in my face saying, oh, you don't know what you're talking about. And then, you know, 25 years later, everyone has fibromyalgia, right? Every single thing they cannot explain is fibromyalgia. Now that's outdated. Fibromyalgia is now outdated, but it's now chronic inflammatory response syndrome that we're seeing it. But just please remember that it's more than 100 symptoms, and it is huge. Like Dondi said, there's symptoms that are so weird, no one can associate them to menopause, but you are the one. So this is what we do at Eden, right? We empower you with your health. We empower you with knowledge. We empower you with really, really easy and awesome tools to get into it. So you want me to get into the map?
Yeah, let's get into the map. And for those of you watching, you heard Adriana just talk about all of these symptoms. What is one of the main symptoms you are having? Put it in the chat, whether you're on YouTube or Facebook right now. We would like to see it. We're broadcasting in different places. Adriana is going to start talking about the map and this work we do, which helps these symptoms that you're dealing with, and the pain and the fatigue and everything else. So talk to us a little bit about this map.
The map, well, you know, I talked to you. I talked to Dondi for a long time about, Dondi, we have to open this up to women, because this was only for the graduates. You know that. This was only for graduates. This was only for second year energy students that would study this. And, you know, we really thought it was time to open it up to everybody. And the map is something Donna laid out. You know, Donna can see energy, and she also helped so many women through this transition. So she began laying a map, and that's what we studied in the certification program. And now we're bringing it to you. We're also marrying it a little bit with functional medicine, but it is really, truly what Donna's work has been all along. And the map has 7 steps. Okay, so you've probably, if you have heard the word menopause, or Oprah talking about it in our country, there's our Mexican Oprah talking about it. That's awareness, and that is great to have the awareness of what is menopause, because you at least are like, okay, so this might be something, I might feel like this because of menopause. You know, people will come in, patients will come in and say, oh, my cholesterol is high and my blood sugar just spiked. And I say, don't worry, honey, it's menopause. We'll fix it. Don't worry about it. And they really do get fixed. I have osteoporosis. I don't want to go into the phosphonates, which are the medications for bones. And I say, don't worry, we'll get them strong, but it's all hormones. So first step is awareness. That's the first step. Second, there's a hierarchy of hormones that if you don't get them humming in place, you will never get the other hormones to hum. So it is cortisol, melatonin, and insulin. It is how we deal with stress, how we sleep, and what and how and when we eat. And we're going to go through all of these from the energy medicine perspective, which is our beloved triple warmer spleen axis, and from the functional medicine. But you have to get these hormones going. And Donna, the first day I met her, she was always talking about calm triple warmer down, calm triple warmer down, calm triple. And that really, truly is the first step, even in functional medicine. If you don't know how to bring cortisol down, you will never get the other hormones back. I have a lot of women come into my practice saying, you know what, I am on a hormone replacement therapy. It's not working. And it's not working because they're not doing the second step, which is the hierarchy of hormones. So we're going to go through that. The third, so first is awareness, second is the hierarchy of hormones, third is rhythms. If there's anything Eden Energy Medicine is amazing at, is bringing us back to rhythms. And we have great ways to go into a circadian rhythm, which is the most important, the 24-hour wheel. The lunar rhythm, which is really important for us as women, right? We are always pictured with a moon, and that's no joke, it's no mistake. We are lunar beings. And the third is the seasonal rhythm. And you have to know how these hierarchy of hormones flow into that rhythm. So that's the third, right? Fourth is thyroid. Thyroid is the child of all of these. And if you get this into rhythm, the thyroid will be okay. You have no idea how many women come in menopause because they're taking thyroid medication, it's not working. Their doctor's cranking it up, they're feeling really bad. So we kind of work with all of this to help it. So that's the fourth step, right? Thyroid. So awareness, hierarchy, rhythms, thyroid. 5 is detox. Detox, we take it very seriously at Eden Energy Medicine. And this is the other step that I see more women hang on. So it's hung on in the sense of they're stuck in this. It's liver and it's large intestine. And we really need to understand how to detox because we are living in a sea of pollutants, right? This last century, this past 100 years, we've seen introduced 80,000 or more, I believe, pollutants into the earth. So we have to deal with all of this, and our liver has to deal with all of this. So we really need to find strategies, really easy, nice strategies to detox. So that's the 5th step. 6th step is what everyone loves, which is the sexual hormones. And energy medicine and Chinese medicine have a really awesome way to look at menopause. They see, among other things, that your yin meridians have come down in potency, right? They're not as vital, they're not as strong. So with very easy exercises, we teach you how to bring these hormones back to life and to strengthen all the yin meridians. It's really awesome. It's really amazing. And then 7 is all the extras people love, all the tips for osteoporosis, vaginal dryness, skin issues, hair, what else am I missing? Night sweats, how to take care of your breast in menopause. It's really important because 75% of breast cancer diagnoses come after menopause. And we're going to have all of this. So the map is awareness, hierarchy of hormones, rhythms, thyroid, detox, sexual hormones, and all the extras. That's all we're going to have. I mean, it's going to be really a ride.
This is fantastic. And what you're talking about is our menopause class. So if you're watching, this is something you don't want to miss. It is May 3rd and 4th. And a couple of things about our classes. Number 1, you get the recordings. So if you're thinking, oh, I can't be there for that full weekend, or I have something else planned, register. You get the recordings, you watch it at another time. And one of the best things about our company, and I love this, is if you take the class, let's say you get the class May 3rd and 4th with Adriana, you take the whole thing, the weekend is done, for whatever reason you think it just wasn't for me, it just was, I didn't get it, we give you your money back. All of it. We don't even ask you a question. There's no guilt. There's no nothing. We say it wasn't for you. Here's your money back. Why? Because we want you to find the classes that are right for you. We want you to find what matches you and what lands with you. So there's zero risk. We have some staff members, Carrie and Kelmy, putting links into the comments. You'll see the link that you can click on later, but don't leave us yet, because Adriana, I would love to ask you, if somebody is just here right now thinking, I really wish you'd teach us just one little technique. Could I have one little technique? Would you do that for us? Would you show us something?
All right, so I'm not going to give the best ones. I'm going to reserve that for class. But being that cortisol is the hormone that drives, it's the first step, and it drives everything else in the map. Okay, everything else is driven by cortisol. So we're going to give you a beloved Eden energy technique to help bring cortisol down. And I do this, and I really do it. But this is not a one and only. This is not a one and done. You have to train your system. So if you are in cortisol, you really have to do this at least once a day so that it can help you, okay? Because if you do it once and say, I didn't feel anything, no, of course you're not going to feel anything. So you have to do it a lot in order for it to work, okay? But it is so simple, and all the energy techniques are so simple that you think, really? Really? It's just like if I showed you an abdominal right now, you would look at me going, okay, well, but if I do them, right, 4 or 5 times a week, and I eat correctly and all of that, I will get my 6-pack, right? So here it is. This is your 6 energy pack. Okay, so you're going to put your fingers on top of your eyes, and you're just going to breathe. And this feels so good. I can do it like this. I can do it like this. It just feels so good. And then you drag them out to your temples. And here I like to say something. Okay, so on those days that I don't think I will be able to do everything I have to do, I'll just say, you're okay. You have amazing adaptation capabilities. You can do this. You're more than prepared. And I just take a few breaths. And then I'm going to go back on the ears, on top of the ears, go back. And then you can land right here in your neck. This is really good because this is also activating vagus. Now from here, sometimes I really need some comforting. So there's 2 variations here, but what I do is just go down the arms and just say, shh, I'm going to be okay. I know I'm going to be okay. And this is really helping triple warmer and calm cortisol down. So this is one way you can do it. The other way is from your neck, come down to your heart and just say, I'm being guided. I'm okay. I'm all right. I'm trusting, right? Whatever comes up in the day. So those are the 2 variations. So eyes, temples, over the ears to the neck. And then you can either go up and down in your arms or just finish here. And that is a really, really, truly amazing way to get cortisol down. I'm telling you.
Wonderful. So you've mentioned the triple warmer, which is an energy system, a meridian. You've mentioned the vagus nerve. Remember, when you say Vegas to us Americans, it's Las Vegas. So it's really clear. It's the vagus nerve. And Adriana, would you take a moment for people who are watching who are new to us? If this is an old hat, you know this is the triple warmer smoothie, but tell us exactly where our fingers are going. Which points are these? What points do we go over? We're hitting so many profound and powerful areas of the body, even though, as Adriana said, it doesn't seem like it. I mean, what's that? That seems like nothing, but it is. So will you tell the viewers for us?
Yeah, this is triple warmer, which is a big meridian. Meridians are lines that run through our bodies and they impact our organs. But triple warmer is one of the most powerful meridians, and it is the one in charge of cortisol. So when you cover your eyes and you go to the temples, this is a really big point for triple warmer. And then as you go back on, like over your ear, what you're doing is tracing back that meridian, just bringing it peace, like saying, okay, okay, calm down. And right here, you're hitting both triple warmer, the meridian, and the vagus nerve, which is the most anti-inflammatory nerve we have, and it is an antidote to triple warmers. So you're hitting it right here. And then when you go to the heart, you're connecting triple warmer to heart, because those two really need a connection for you to be okay, for your hormones to be okay. And then the other variation, when you go like this, you're tracing triple warmer again. So it is called a technique. It's tracing the meridian back, but when you trace something, you calm it. It's like, okay, you're gonna be okay. You're gonna be okay. You're safe. You're gonna be okay. You can do this. So that's what we're doing when we're doing that.
Wonderful. Thank you. And I'd like to read one of the comments I just saw. This is from Heather. Hi, Heather Bolte Lewis. She says, I have had a spot of extremely itchy skin on the sole of my foot. No medication helps. It's been about 6 or more years, and I'm now wondering if it's one of these strange symptoms. Adriana, how often have you heard, there's nothing that will help it? There's nothing that will help whatever the ailment is, itchy skin, these unable to sleep. And I think it's 60% of women experience an inability to sleep during menopause. How many times do you hear, I don't know what to do, nothing helps? Well, I'm telling you, Adriana will help. This class will help, because this class is unlike any other class, anything you've seen on the internet. This is different. No risk, because you can get your money back if it's not for you. But Adriana, isn't that true that women feel really stuck, and we're going to help them get unstuck?
They feel stuck. They feel so frustrated because they've been through so many doctors. And one of our testimonials speak to that. I don't know if when you're going to post them, but this is one testimonial, but we've had several. Itchy skin is a huge one in menopause. And this woman had cancer, kidney cancer. And the doctors would not do anything because they were so afraid of doing anything with her because she had cancer. And when she started balancing their hormones, she came back to life. Her feet just magically, the skin just magically healed. It was like, oh my gosh, what did you do? Because we didn't even address that. We were just balancing all the hormones. And it was all, that's I think you have it, Dondi, Natalia's testimony, which is impressive. So yes, it can be menopause. And remember, it is so individual. Someone can have a really weird taste in their mouth, and that could be menopause. Someone could have their hairs just falling off. It's menopause. Skin is menopause. Urinary tracts, all that we mentioned. Frozen shoulder, they do not relate it to menopause, and it's just menopause. I had a woman who had numbing right in her hands. She had trigger fingers, she had numbing. In the morning, she would wake up and she could not move her hands. And she was about to get surgery. I'm telling you, surgery, neck surgery. And she said, do you think this could be related? I said, I think so. Why don't we try 3 to 6 months? And if you're the same, you can go and get the surgery. The hands completely came back. I mean, her sensation, no more numbing, no nothing, no trigger fingers. It was amazing.
That is amazing. And Adriana, I do want to read one of these testimonials. This one is incredible. They all are. This is from Natalia. She says, I am a patient of Dr. Barraza's. She did all of the exercises that you prescribed. She committed to them. And oh my gosh, 15 minutes, 3-4 times a week, not a big deal. And she says, I can honestly say the treatment has been life-changing. Before I began, I was struggling with low energy, brain fog, the constant feeling that something wasn't right. And all her hormone levels were considered normal by the tests, by Western medicine. The only visible symptom she had was dry skin, which was completely dismissed by most of her Western doctors. And we are not bashing Western doctors. We're just saying they haven't found the answers. And with energy medicine, you can find these very unique and personal answers to you. So she goes on and she says, my joint pain has been relieved. My tingling sensation in my hands is completely gone. What Dr. Barraza has taught me has restored moisture to my hands and feet. My fingertips and ankles used to crack and bleed. No matter how much cream I used, that is no longer an issue. Her nails are stronger. Her hair is stronger. She manages her weight now. She feels like herself again. How fantastic is that, to feel like yourself again? She goes on and on. There are so many testimonials like this. And again, we like to pair with Western medicine. We want to come together with Western medicine, and we have answers for you. And join us. That's all I say. Just join us in the class. Adriana, as we wrap up here, is there anything else that you would like to tell the viewers?
Well, you know, what Natalia said is really important. A lot of women come to me saying, my hormone levels are normal, and they feel anything but normal. So menopause, again, menopause is highly individual. It is not something that we go through. We are going to stay in menopause from 50 years on, and we need a really easy way to balance our hormones, because they are the fountain of youth. They make us feel alive. They make us, all the testimonials, they are from real patients. They're my patients, and they really, all of them say, I felt like myself again. I came back to myself again. I'm vital. I'm sexy. I'm sexual. My skin changed. My hair changed. My nails changed. My infections changed. Everything changes when you look at hormones. So in Eden Energy Medicine, what we do is empower you. All the classes in Eden Energy are to empower you. And this is to empower your hormones, which really, truly are the fountain of life. So that's all I'm going to say. And like Dondi says, you have to commit. But 10, 15 minutes is nothing, nothing. People don't believe I am 64. Still.
Adriana Barraza, if you keep saying this, that you're 64 years old, I'm going to get you. But we should say we are both, I think we're both in our 50s. I'm headed towards 60.
Yeah.
And because I did this work, I really sailed through menopause. I'm like, is it here? Do I have it? Oh, yeah, maybe I have a little blemish so I can see it. But I really sailed, and I have done this work all my life. I do the work. It doesn't take much. A couple minutes here, a couple minutes there. I make it a part of my lifestyle. It's fun. I do it in public. I'll do all the crazy techniques. People will be like, what are you doing? And then I get to show them what I'm doing. Oh my goodness. It is such a blessing to have you, Adriana, in our midst to be teaching this class. It is a lifesaver. Join us May 3rd, May 4th. If you can't be there for the whole weekend, no worries. You'll get the recordings. You see the link on the screen. You see it in the comments. Join us. It is 50% off right now, but only until Friday. Yeah, 50% off only until Friday. So just go in and sign up. Do it.
You know what? And 50% off. It would not even be 2 visits to the doctor. I mean, if you were paying, it wouldn't even be that. And you are getting the whole map, the whole enchilada to know how to do everything. It's amazing. You really will. It really is. These are skills for life. This is skills for life.
Yes, thank you. Thank you, Adriana. Thank you to everyone behind the scenes helping us. Thank you, Corey. Adriana, I will see you May 3rd and 4th. I will be there, and I hope to see all of our viewers. Have a great week, everybody.